Hello and welcome to this workshop. My name is Dr. Grace Bagwell Adams, and I am an impact evaluator. The title of this workshop is Understanding Program Evaluation Tools for Success in Grant Applications. And today I'm going to explain a little bit to you about what program evaluation is, and more importantly, how you can leverage some of these components of evaluation into the incredibly important work that you do in your nonprofit organization, specifically so that you can be more successful in building evaluation into grant applications for funding to secure more support for the very important work that you do. So first, a quick overview of the workshop. Number one, I'm just going to introduce you to the concept of what evaluation is. We use this term quite a lot, but I think that doing some very basic vocabulary building is really important so that we understand we're all on the same page when we're talking about what program evaluation means and what you might be expected to do in a grant application. The next thing we're going to be doing is talking about two essential components of program evaluation. These are some of the most important tools in your toolkit, and that includes a theory of change and a logic model. So by the end of this workshop, you'll not only understand what those things are, but also how to use them to build meaningful evaluation into your projects. And then we're going to really switch gears and make sure from a practical applied standpoint you can use these tools in your own grant applications. I'll conclude with some additional resources if you're interested in accessing those, and also some key takeaways for you and your organization as you prepare for funding opportunities. So again, just to introduce you, today we're here to talk about how program evaluation concepts can really help nonprofit organizations in Northeast Georgia build robust theories of change and logic models. And that's really to secure grant funding and also to measure impact. So this is not necessarily just about telling a story for funders. This is also really about improving the quality of the work that you do, because if evaluation is done well, it can actually be used to improve service delivery to make it more efficient and effective with the resources that you have. This workshop is brought to you today by the incredible Athens Area Community Foundation. And Athens Area Community Foundation serves Athens and contiguous counties and invests a lot of resources, both in terms of grant funding for local nonprofits and to improve outcomes in all of our communities regionally, but also in actually building capacity of nonprofits and professional development above and beyond even the dollars that come out the door of the Community Foundation to fund organizations. So this is really a part of a bigger umbrella effort of the Community Foundation to support you, to support the work that you do, and to make you more successful, not just in getting community foundation grants and funding support, but in just long-term success for other funding opportunities, as well as really improving the quality of your service delivery and improving the quality of your board governance and all of the other aspects of the important work that nonprofits do. So the Community Foundation is investing in all of those aspects of the nonprofit sector regionally, and this workshop is one component, one small component of that very essential work. So let's just talk again about the purpose of this webinar. Really what this is to introduce really basic concepts of program evaluation for nonprofit organizations. No matter what your size is, no matter what um, your annual budget looks like or how many employees you might have, these concepts really can be applied to any nonprofit of any size or scale. We are going to talk about how evaluation tools might be incorporated into your grant applications. And again, ultimately, this is to increase nonprofit capacity in Northeast Georgia. So let's talk about understanding this term. Program evaluation is essential for communities and organizations, and it really can aid in the enhancement and strengthening of your activities and your programs and systems. It involves systematic data collection and analysis to assess effectiveness of your work, of your programs, or of policies or organizations in general. Evaluation can provide some really important insight into the strengths of your program and your work, but it also can show you critical areas where you might can improve the work that you're doing. And that is true for a program throughout its life cycle. So you could be at the very beginning of an intervention, or you could be 20 years into the work that you're doing. Program evaluation can be useful to you at any point in the life cycle of your work. It can really help you understand resource adequacy. So whether you have enough resources to do the work that you do, operational quality, and intended and unintended outcomes. At its core, what this is a method of using information. It's really that simple. So again, we use this term program evaluation. You hear it, you've probably heard the word evaluation in particular quite a lot. You might be saying, okay, well, what does that really mean? Well, it's really just a method of using the information, the best information that you can get to show impact and efficacy of a program or intervention. What we believe that the we being the people that do this kind of work is that it's really essential to the work of nonprofit organizations. So, unlike research, which really exists to contribute to generalizable knowledge, program evaluation focuses on practical, applied, real world work and thinking about how we can assess that work to make sure it is having the greatest possible impact to improve our communities. And so the central focus of program evaluation is continuous improvement and offers findings for decision makers. That can be executive directors of your organization. It can be to help guide your board members in making decisions for your organization. It can even help guide your staff members in the execution of a program or the improvement of a program. And what program evaluation can do is really clarify how to enhance your existing work, why some certain implementations may fall short or be really succeeding really well. It can help you understand that with those questions. And you're going to use and analyze trends and data over time to do that. It can also help you make a decision, even on the front end, as to whether or not you should proceed with the project. So, again, regardless of when you start this work in the life cycle of a project, ideally it's on the front end. But let's say you've been doing it for a really long time. It doesn't really matter where you are. Evaluation can be really helpful in helping you understand not just your impact, but how you might improve that program. So, why is program evaluation important above and beyond the reasons I've already stated? Again, as an impact evaluator, I believe it's important because it can really help you do a great job internally. But let's talk about some external motivators as to why program evaluation is important. I would say that in the last decade in particular, I have seen a big shift in the focus on evaluation and specifically at the federal level that's now filtering down to the state level and even the local level, moving toward what I would call community impact models for funding. That is to say, a lot of funding opportunities now, whether that's a grant or a gift of some kind from a foundation, really expects that there is an evaluation component in the work that they fund. In 2018, there was actually some legislation that passed at the national level called the Foundations for Evidence-Based Policymaking Act. And that really emphasized program evaluation as a crucial function at all federal agencies. Of course, we're recording this webinar in 2025. That was 7 years ago now. But that federal legislation really just reflects what was then a growing trend and expectation of federally funded programs and interventions to incorporate systematic investigation into the effectiveness of their programs through program evaluation and seeing that national movement really permeate its way down even into very local nonprofits. This has led to an increased investment in building evaluation capacity and using findings for ongoing program improvement. And so I would say that getting to the why question for program evaluation, it's really two layers to synopsize what I've said thus far. One is you really want to make sure that you're stewarding your resources in your nonprofit as best as possible. You want to make sure that every single dollar that you're using, every single minute of the time that you're using to deliver services and to help your community is being used as effectively as possible. That's just being a good steward of your resources internally and also making sure you can make great impact. That's one intrinsic or internal organizational reason to do evaluation. I think the second piece, though, as I've just said, is that a lot of the funding opportunities in the last decade have shifted to really expect that impact evaluation is built into receiving that funding. And so, in order to continue receiving funding and for you to have a sustainable um, aspect of the work that you do and showing that you're having impact so that you can justify continuing to receive support, I think we'll continue to see this as being very important for nonprofit organizations. So, what that requires of nonprofits, really, especially small nonprofit organizations, is if you are going to be competitive for funding opportunities, then you really have to have capacity around evaluation. And even if that doesn't necessarily mean having a subject matter expert or an impact evaluator on staff or working with you, you still can start to build some of these tools and components into your work. And that's why we're here today. So just to recap, you're already delivering critical services to our communities. That's work you're already doing. So if you're doing it, let's measure it. Let's show it. Let's show how you are moving the needle and helping families and communities across our region. You need to be able to show donors, stakeholders, granting agencies the impact. Okay, that's what we've just said. And we know that this work that you're doing is mission driven. Let's show how the impact is really helping you accomplish your mission and making the community better. Doing so can lead to more financial support for your work and I think other benefits too. So, process improvements can sustain community support and helping those dollars, which can be extremely competitive to receive funding, helping those dollars go further for you. So, what we're going to do now is really talk about two terms that you will hear. This goes back to the vocabulary building aspect of this workshop. Two terms that you will hear a lot with the words program evaluation are effectiveness and efficacy. So, I want to unpack both of those for you, make a distinction between the two because the distinction is important, and then we'll talk about how we can use these terms in your work. So we're actually going to start with efficacy. So this means that we're looking at how a program works in a controlled setting. Think about in a lab setting, right? If we could control all of the factors that might impact an outcome that we care about, that's when we would be measuring efficacy. A good example of this would be a pharmaceutical in a trial, right? In a randomized control trial. They're really, especially in the first couple phases of measuring the impact or the effect of a new drug on a health outcome or as a treatment for a particular illness, you're looking at efficacy. That's looking at how that medication is working in a very controlled setting. This means we want to understand the ability of this medication, for example, to produce a desired effect or outcome under very specific controlled or ideal conditions. And so that measures where the intervention works as intended when implemented precisely as designed. Okay, that's what efficacy means. We're going to distinguish the concept of efficacy now from effectiveness. And really, for the rest of today, and in general, when you're thinking about program evaluation in a nonprofit setting, we're really focused more on using the idea and measuring effectiveness. That's because we are looking at how a program or a policy is working in the real world where conditions may vary. So remember, if efficacy was what we were measuring in terms of how well a program is working in an ideal or very controlled scenario, effectiveness is let's look at how that program's working in the real world. And for most of you all in nonprofit organizations, that's what you're doing, right? You're doing work, mission driven, mission oriented work, and you are trying to deliver services or improve outcomes for communities in the real world. So when we talk about, okay, how well is a program working, the term that we're going to use is how effective is that program at achieving your goal? In the context of public health or social programs, again, this is typically where we're going to live. And it really is about the actual performance of your program in typical practice. And so this just drives that point home. So again, we're going to focus more on effectiveness because you're doing your work in the real world. So the next thing that I want to look at and talk about here are the types of evaluation questions used to assess program effectiveness. So if I've convinced you thus far, evaluation is important, right? And then the next thing I've shown you is okay, when we look at program impact, what we're really going to the term we're really going to use is effectiveness. Let's look at the kinds of questions that might drive our ability to measure effectiveness, to measure whether that program is working as we had intended. So the first is implementation. So this is looking back, once a program has happened, this evaluates if the program's activities were executed as planned. Okay, so according to the original design of the program, I'm gonna talk to you today about a logic model, which is a roadmap on how we think that program's gonna work. Looking at that original design, let's look at the implementation and identify any adjustments that might be made during implementation. Okay, this is really important for organizations, especially if you're doing repeat activities or repeat intervention, or if there's a life cycle that has a repetitive aspect to it, right? Like, let's say you're working every academic year on a particular kind of intervention and you're repeating that intervention every single school year. Implementation effectiveness is really important to understand because if you can learn something from one year to the next, what worked that first year we implemented the program? Okay, how might we make adjustments to make that program work better or be more effective the next year? That's an implementation effectiveness question. Okay. The second here is really focusing on outcomes, determining whether the program is meeting its defined goals and objectives. That's effectiveness, which we've already talked about. This is often measured, by the way, through specific indicators of success. And so in evaluation, when you build the tools and the roadmap for how you do evaluation, you want to talk on the front end. How do we measure success? How do we define success in this particular program? And then you'll look and see, okay, at the end, did you achieve that specific defined measure of success? Another way that you might think about measuring program effectiveness would be looking at the efficiency of a program. So this says, okay, did we use our resources well? Did we ensure that our activities produce the desired outcomes without wasting any time or money or effort? Efficiency is a concept you hear about all the time. We talk about, especially at the federal level, you hear lots of discussion. Is this program efficient? Really, what that means is, are you getting the best bang for your buck out of that program? Cost effectiveness sort of marries concepts of effectiveness and efficiency together. This analyzes whether the benefits gained from your program justify the cost that incurred. So if you look at what was achieved and the success that was achieved, did that success match or exceed the investment in that program? Right? And that helps to determine whether the investments are worthwhile. And then finally, we have this idea of attribution. So this evaluates whether observed changes in goals can be directly linked to a program rather than other external factors. There are lots of things that are happening in the real world. We've already defined that, right? The work that you do happens in the real world. There are all kinds of things that are happening in the real world that are outside of your control. A really great example here is if you've got a nonprofit organization that's working on workforce development, you can be working around the clock 24/7 at the local level to really make sure that you're getting some supports in place for families for workforce development. But if the economy tanks and we have a recession, then that's outside of your control. That is a real world situation outside of your control that directly impacts a family's ability, an earner's ability to get a job and keep a job, right? So in this particular case, number 5 here, attribution, we want to make sure when we're measuring to see if our program had an impact, that we're actually measuring the impact of that program and not some other factor. These are just some of the considerations, again, just to synopsize this slide, some of the considerations that you need to keep in mind when you start thinking about evaluation and what you're trying to measure and how you're trying to measure it. So I would say that in addition to thinking about the how of assessment, we want to think about guiding standards for program evaluation, okay? So here are 4, and again, this is not a complete kitchen sink list, right? Here are just 4 things that you might consider whenever you're starting to wrap your head around how you're going to evaluate your program. I think the first and most important question is about utility. This question is, who needs the evaluation results? Is it a funder? Is it your board? Is it your staff? Is it other key stakeholders or families that you're serving in the community? I think you just need to figure out from the beginning, who is your audience? Some of the advice that I'll return to later around stakeholder engagement is it's best to really go ahead and figure out these questions early and to include any key stakeholders in your evaluation work, even from the beginning that you can, and make sure that you continually include them in your feedback loop. Okay. But you need to think about who needs these results and will those results provide relevant information in a timely manner to them, right? If you've been working on a program for a couple years in the community, and then that program ceases to exist, and you never say anything about the findings or the impact of that program to the community or to your donors or your stakeholders, it's going to be really hard to justify continued investment in a program like that if you don't actually share results, if you wanted to try to get that program started again. Second, let's go to feasibility. Okay. Are the planned evaluation activities realistic given the time, resources, and expertise at hand? You have to ask yourself, if I'm applying, for example, for a $20,000 grant, okay, and I have a 1 year timeline to spend that funding, I need to make sure that the goals of my program align with that 12-month timeline, and that the activities and the outputs and outcomes that I hope to carry out and achieve from the program are actually feasible with that amount of money. Okay. So this is really just thinking through, can you do what you've planned to do? Okay. Is it feasible? Propriety. I think this is one of the most important things, again, that we can think about. This is, does our evaluation protect the rights of individuals and protect the welfare of those involved? Typically, with nonprofit organizations, you are not only working in the real world, you're working in communities. And a lot of these communities, a lot of these households and families, um, have different levels or layers of vulnerability, especially if you're serving children. You really need to think about some of these populations, these high needs populations, older adults, children, individuals with chronic conditions, whoever it is that you're serving. Okay, especially though if they're in a vulnerable community, does this evaluation, does the approach that I'm taking protect their rights and protect their welfare? Um, Fourth and finally is accuracy. So you want to make sure that your evaluation results are valid and reliable given the needs of those who will use the results. Okay. This is why with program evaluation, you really want to make sure you collect good data, and you want to collect information that is reflective of the entire community that's been served in your work. Okay. So if you are doing an intervention that's serving a lot of different people, talking to only one or two or even 10 of those people to understand the effectiveness of the program is probably not going to be enough. Okay, you need to think more systematically about, how do I get good information that allows me to truly measure whether the changes in the outcomes that I'm hoping for in this population have been achieved from this intervention. One of the guiding tools that I really like to use when I do evaluation work is depicted here. Okay. So this is the CDC, the Centers for Disease Control. Their program evaluation work really is just a pictorial diagram, I think, of how you can conduct evaluation. I think that the first thing to notice here is that it's a circle, right? The shape of this is a circle, which connotes, excuse me, which connotes a cycle. And so evaluation is something in an ideal situation that you actually do not once, just once a program's over, but throughout the entire process, in the planning of the program, the execution of the program, and then looking back once it's happened to see what happened. Did we achieve what we wanted to achieve? If you look on the outside of this circle, you see there are some values here that really encapsulate, I think, one of the last concepts we discussed, propriety, right? So let's ask ourselves the question, are we engaging collaboratively? If you look here on the top right-hand side of the circle, if you go to the left side, does this evaluation advance equity? Okay, is it fair? Does it advance fairness and well-being among all? And then at the bottom, did we learn from and use our insights? So you can do the most beautiful evaluation in the world, but if you don't actually learn from your findings and put those findings and that new understanding to use, then it doesn't really do a whole lot for you. Okay. Again, this is just a nice pictorial evaluation framework, just a nice depiction of the CDC's approach to this. There are many different versions of evaluation frameworks. I just wanted to introduce one to you to just draw attention to a couple of these concepts that evaluation work can and should be done throughout the life cycle of a project, and that you really should prioritize and value um, and promote collaboration, advancing equity, and really learning from your findings every time you do this kind of work. Okay, so we're now segueing in the webinar from me introducing the concepts of program evaluation to you and some key concepts like effectiveness, some of the standards that we might think about, and just in general, the underlying motivation for program evaluation. We're now transitioning into the first of the tools that I'm going to introduce for your work in nonprofit service delivery and in trying to get funding for your work. And that is a theory of change. Okay. A theory of change is really just an explanation of how your program is going to lead to intended outcomes. At the end of the day, it's that simple. I'm going to say that again. A theory of change is a straightforward explanation of how the proposed activities are going to lead to intended outcomes. Okay. The theory of change is really the first stop on the evaluation um, pipeline, and it precedes the logic model, which we'll talk about next. So, what does the theory of change do for us? Again, we need a concise statement of how we're going to achieve change. How are you going to change the world or your community or the lives of the families in your community with the intervention? Okay. And it really, at its heart, a theory of change describes the rationale for the program or the work. Okay. So that's really what it is. You need to be able to state succinctly in a sentence or two, okay, what the reasoning is for the program or the work that you're proposing to do. So there are typically assumptions that underlie why certain actions will lead to specified results. Okay. And we'll talk more about that in a second. But the logic model is basically the bedrock of all program evaluation. So it's the aspect of evaluation that helps the organization articulate root cause. You all do work in communities in which you live, work, and play, right? You know that community typically pretty well, the community that you serve. And I would say that there are probably lots of underlying assumptions that you carry with you in your daily work that are part of your understanding of what the root causes are for the social and health problems that you see and the ones that you're trying to help. There's usually a lot of different contextual factors here that are contributing to the existing issue or sort of circumstances. Okay. I'll give an example of food insecurity. Families or households that are experiencing food insecurity, there's typically a lot of reasons as to why that is. A big part of it, of course, is usually income, right? The family may not have the financial means to purchase healthy food on a consistent basis, but there could also be other factors, transportation, okay, um, is a big one, right? So there are many different contextual factors that need to be identified when you're developing your theory of change. And you just need to question yourself and say, what are the assumptions I'm making about this problem in our community? And how do those assumptions sort of guide my beliefs about what needs to happen to solve a problem? That's really the bottom line here. If you look at this last bullet point, when developing your theory of change, you want to ask yourself, what are the root causes of the issues that we face in this work? It doesn't necessarily mean that your nonprofit has to solve all of those root causes. I'm not naive to the fact that clearly there's no one single nonprofit organization that's going to solve poverty, for example, in a community. But you need to understand and at least have a discussion about what those root causes are to make sure you're not missing the mark as you design an intervention. I think that if when considering the theory of change, a couple of other really important considerations are um, really thinking and understanding about the relationships that will stem from the theory of change. So the theory of change emphasizes the connection between the problem that your organization or program is trying to solve, okay, and then the solution that you pose or that you suggest or that you're working on to solve that problem, and the connection between that solution and then the outcome that you hope to achieve. Okay. So if you believe that the solution, for example, to a certain problem for food insecure families, let's go down that, use that example. Let's say that you the root cause or the thing that you're trying to address is food insecurity, the root cause of which is, of course, poverty in a lot of situations, most situations, then you'll need to think about a solution that fits that root cause. And you'll need to think about outcomes that you hope to achieve that are measurable, that are related to that solution. All right. So that's what I mean by the focus on relationships and the theory of change. There needs to be a specific sort of linear straight line that you can draw between the root cause, the problem you're trying to solve, the proposed solution, and then certainly the outcome you hope to achieve. One of the things that I think can be really helpful in developing a theory of change is an if-then statement. So we're going to spend quite a bit of time over the next few minutes on if-then statements. So an if-then statement can explicitly articulate a logical relationship between different elements of a program. Okay, these statements help to clarify how specific activities might be expected to lead to desired outcomes. So that goes back to the focus on relationships with the theory of change. If this, then this. Here's how if-then statements can be used in a theory of change. Okay, so the first would be to establish a causal relationship. Here's just an example of a statement where you could fill in the blank yourself. Okay, if we do X, okay, this is an example of an intervention. If we do X, then blank will change. So here's an example. If we implement a training program for health providers on effective communication, then they will improve their interactions with patients. Okay, that is an example of an if-then statement that's trying to establish a causal relationship. In this particular situation, we might assume or we might observe that providers are having a hard time communicating with patients. Let's say it's about some clinical language or a particular set of treatment that they're recommending, right? And so we say, okay, well, if communication is the problem, root problem, again, back to what we just discussed, then we think a solution could be actually training those healthcare practitioners to communicate more effectively. This is the X in this case. So again, if we implement a training program for healthcare providers on effective communication, then the outcome we expect to change. They will improve their interactions with patients. Okay, there's an example. That statement provides a direct connection between the activity, in this case, the training, and the expected outcome, which is improved communication, making the intended change clear. Okay, so this is an if-then statement, right? That helps you really articulate your theory of change. Another thing is that an if-then statement can be really used to connect outputs to outcomes. We're going to talk in a second about how outputs are different than outcomes. I think if you take anything away from this lecture, it's really helping you understand the difference between those two things, outputs and outcomes. But I think that an if-then statement can really help you connect an output to an outcome. Here's an example. If we provide 1,000 free health screenings in the community, now that's an output. If we provide 1,000 free health screenings in the community, then we expect to identify and engage individuals with untreated health conditions. That's the outcome that we would expect from this intervention. Here, the if-then statement really links the output, which are health screenings conducted, to an immediate outcome, which are identifying health conditions, demonstrating the program's anticipated impact. It's incredibly helpful for articulating what you might expect to do. And again, the statement in a sentence tells you what we hope to achieve, okay? You could also state it slightly differently. You can build an if-then statement that looks something like this. If we implement X, then Y will change, resulting in improved blank, okay? Going back to stating it this way, another way that if-then statements can be used in a theory of change, we've already covered two, right? The first was to establish a causal relationship, and the second was to connect output to outcome. The third is really to help you articulate assumptions. Here's an example. If community members receive educational materials about preventive health measures, then they will adopt healthier behaviors, assuming they have access to the resources needed to make those changes. This type of statement highlights not only the intended outcome, but also the underlying assumption that really undergird the expected change, right? Emphasizing other factors that may influence success. Another way if then statements can be used is to map short-term, intermediate, or long-term outcomes, right? With programs, there are different time horizons of a program. If I am doing an intervention, there might be certain changes I would expect to happen within 6 months to a year. That would be our short term. There might be some that take a little bit longer, intermediate, 2 to 3 years, or you might even get into long-term category, 5+ years or more. Okay. So if then statements can really help illustrate the progression from short-term to long-term impacts. If participants complete a series of workshops on nutrition, then we anticipate that they will increase their knowledge about healthy eating. That would be short term, right? We would expect that basically, even during a workshop, if not immediately after, that we go ahead and start to see their knowledge levels change. Here's an intermediate impact that we might expect from the same kind of intervention. In this particular example, it would be a workshop on nutrition, okay? So if a participant complete a series of workshops on nutrition and their knowledge increases, then we expect they would make healthier food choices. That's your intermediate. Once knowledge changes, we might expect the behavior change to flow from the knowledge change. Here's a little example of a long-term impact. If healthier food choices are made, then we could see a reduction in obesity rates in the community over time. That really helps you walk through the time horizon on an intervention. We would not expect a series of nutritional workshops overnight to change an obesity rate in a community, but we might expect over time that participants who have received meaningful nutrition education change their knowledge on nutrition. The knowledge change then shifts to a behavior change in terms of the food choices they make, and over time we might then see changes in health outcomes as a function of those behavior changes. Building a hierarchy like that, if you expect the program to have short, intermediate, and long-term impacts, can really help delineate the sequence of changes that a program aims to achieve. And that could really help provide a clear pathway for you from program activities, in this case, a nutrition workshop, to desired impacts, which would be, in this particular case, a decrease in the obesity rate and improvement in long-term health. Again, that was just another example of how you can phrase the statement. Okay. I think that just some closing thoughts on a theory of change as we go into the next phase of it, building your toolkit, which will be a logic model. So I'll go back to this slide for just a second. Is that again, the if-then statements and the theory of change in general. So really just help you track the relationships that are laid out. And it can also help support your data collection efforts to measure success, right? So if you're clear about what you hope to change in your community with your intervention, then you know what things you can measure, okay? Or what things you need to try to measure. Incorporating these statements into a theory of change can really help provide a clear, logical framework for your stakeholders too. Sometimes nonprofit organizations are so deeply engaged in their work, it's hard to see the forest for the trees, right? Like you know on a daily basis exactly what you're doing and why you're doing it. But being able to convey that information to stakeholders, whether that's funders or volunteers or donors, in a really clear, concise manner is super important. It's important for garnering support for your work, for sustaining support for your work. And so I think that getting a clear theory of change in a really succinct if-then statement can help you clarify assumptions and guide program implementation and all of your evaluation efforts. So once you have got a good theory of change, then we're going to move into the phase of building a logic model. Okay, this is the really exciting part. A logic model really is a roadmap. It's a very fancy term for a simple concept, and it's a roadmap. A logic model is a roadmap for how you think your program will work, how you intend to get to your desired outcome. Okay. And that's what I say here. It's a picture, it's a diagram of how your program is intended to work. Okay. It really stems from your theory of change, and it has 5 components: inputs, activities, outputs, outcomes, and impacts. Now, outcomes and impact are differentiated or distinguished simply by that time horizon I've already discussed. An outcome is something that we would expect to change in 1 to 4 years. When you get 5 years or more, that's a long-term change, right? That's a long-term outcome shift, which is more of an impact. So here I've just sort of represented it in just a quick diagram, just putting each of those 5 components into a bucket, okay? Inputs, activities, outputs, short-term outcomes, medium-term outcomes, and long-term impact. It really summarizes the program that you're trying to implement in a structured format, and it will display relationships between the program's resources, activities, and outputs in a concise manner, okay? Um, it really requires you to think on the front end, what resources do you need to accomplish your program goals? That's what the inputs are about. Inputs are about what is it exactly that you need to make this program happen? How much funding? What kind of staff or key personnel time? What kind of physical space? Okay. What other assets do you need? What things, both tangible and intangible, do you need to make this program happen? Activities are the what you're going to do, okay? So it might be developing a curriculum, okay, to deliver. It might be conducting a training. It might be holding a health fair. Any activities or specific things that you're doing to execute the program goes in the activities bucket. Moving into outputs, okay? Outputs are basically what you're delivering. So it might be the number of people attending a training, the number of people or families served in any intervention is a good example of a measure of an output. Again, back to the health screening example I use in the theory of change. It could be the number of people that participate in a health screening. That is an output, okay? And that is not to be confused with outcome. Outcome is actually what you're changing, okay? So if output might be number of people who attend a training, an outcome would be an actual measurable change in that person's or those persons who attended knowledge on the subject that the training covered, okay? That's a short-term outcome. Medium-term outcomes, that's where you start to measure actual changes in behavior and other sorts of community level changes or what we would observe in long-term impact. Okay. So a logic model, I'm going to go back to this slide for just a second. There's a real focus here on making sure you understand the difference between and among these logic model components, these 5 components. It really is specific and action oriented, so you should focus on a specific set of activities and their immediate results. And so this can help be a real practical guide for your program implementation and planning. Here's a great example of why logic models and evaluation in general should be done on the front end of a program. It can help you get really organized so that you can understand what resources you need for your inputs, what activities you're going to accomplish. It really does help you lay out bullet point by bullet point exactly what you're going to do, what you hope to achieve, and what resources you need to achieve it. Okay, it becomes a planning document in essence for you and your organization to carry out your work. I would say that it also is your best case scenario, right? A logic model is typically built on the front end of a program. So this is your plan for how you intend the program to go. In all likelihood, because this work is done in the real world, it will not go exactly that way. It could be that you have need for additional resources to carry out the work that you didn't name in the beginning, or you could have more resources than you actually needed to implement the program. The inverse could be true. It could be that you have to do additional activities to achieve your desired outcomes. But those are things that you find out once you're in the middle of implementation and you monitor and adjust. Okay. So basically, you're really trying to leverage this as a planning document, um, as an indicator of how you intend the program to function. Okay. Rather than how it actually performs. The logic model reflects the underlying theory of change, as we've already stated. And it also can really help you demonstrate the connection between each of these components, okay, between activities and outcomes, and then among different outcomes over time. So on this slide, I've actually sort of presented the logic model in a slightly different visual way. On the left-hand side, you can see here that you've got the different components that I've already presented to you. I've broken them into two pieces. The top are the process components. These are sort of the nuts and bolts of what it takes to do your intervention. Inputs, which are resources, activities, the program events or strategies, and outputs are the products of the activities. It's a great way to think about it. In this particular example, it's just kind of walking you through the basic outline of a logic model for a program that is trying to intervene on um, on community health around STD prevalence. So trying to intervene to decrease the burden of disease related to sexually transmitted infection and disease. So up here, inputs, resources, what might you need? Here's an example: funding, staff, materials. And this is a really broad, super simple outline. If you do this exercise for yourself, you really want to understand, okay, exactly how much funding do you need? How many staff persons? What materials? So just as an example, though, inputs, funding, staff, and materials, activities, that could be patient testing and treatment or staff trainings. Okay, those are activities. Outputs, the number of patients treated, the quality of the trainings delivered. Okay. Again, differentiating outputs from outcomes. Now we're going to move into the second layer of the logic model here, and that's where we start looking at the intended effects. How do we expect the world to be different because of this work? If you look at short-term outcomes, we might expect a change in the proportion of patients treated. We may be able to reach more patients now, okay, because of this intervention. We could see changes in knowledge, skills, or belief. Intermediate, this is where we would continue to screen and treat even more individuals. So we might be able to actually reach the proportion and increase the proportion of partners treated. We might see increases in contraceptive use, or we might even see changes in policies or behaviors. So again, we typically don't expect to see changes in behavior in the short term. That really is around knowledge, attitudes. What we would expect to see changes in behavior, where that would occur, is in the intermediate and long term. And then finally, in long-term outcomes, we might actually start to see in the community a reduced burden of disease. We could actually see fewer people with sexually transmitted diseases and changes in morbidity or mortality. So again, just giving you an example of a health intervention and just showing you how exactly that can be used to help you get organized and understand what you think the program is going to do and how it will impact your community. And this is my red bright slide again to say outputs are not the same as outcomes. In almost 20 years with working with nonprofits and thinking about evaluation, what I have learned is that a lot of nonprofits are really confusing outputs and outcomes. And so you want to really spend some intentional planning time thinking about when you are creating a grant application, whether it's for the community foundation or for other entities, what you really want to do is make sure that you are saying, here's what I expect to change. Here are the outcomes I expect to change. Not just here's how many people I served. Okay. Saying how many people you're going to serve or how many people you're going to train, that's an output. What we are looking for is that in addition to that, in addition to saying, here's how many were served or here's how many we reached, you can say, and here is how the community or those individuals that were served changed because of that service or because of that program. Okay. So I will just close up the introduction to logic model by saying that a straightforward one-page logic model can really effectively summarize most program components, okay? Um, and there's going to be variation. There's going to be a lot of differences in the kinds of work that nonprofits do and in the audience listening to this webinar, I realize. But the typical elements of a program remain the same. Okay, and here's another. It's just the same thing, just looking at on the left-hand side, situations and priorities and assumptions. All of those things are things you might think through as you develop your theory of change. And then these other buckets here are the five that we've already talked about. And so we would really look at just how do you really use this as a planning document to help understand how you expect the world to change. Okay. Okay. So I want to move now into application. So this is really where we take some of the concepts that we've learned about today and we said, okay, let's really understand how we can put these evaluation tools to work for your organization. So I've introduced you to some big and broad concepts: program evaluation, effectiveness and efficacy. We've talked about the principles of evaluation. I've shown you a framework. We've looked at some of the most essential components, which are theory of change and logic model. So we're going to talk about how to put this to work for you. Okay. So the first thing that I would say in really building a theory of change, think about the application you're building to submit for funding. And again, this webinar is provided to you by the Athens Area Community Foundation, and there are lots of regional funding opportunities that will be open for you either through the Community Foundation or other sources. And so, what I would encourage you to do is really think about the application you're building to submit for funding. What are you proposing to do? How will the work that you are proposing to do change the set of circumstances that might lead to improved outcomes for families? I would just start with that question. And then once you answer that, build your if then statement. Okay. And this doesn't have to be a big, long document. We're talking about really drilling this down to the very basic aspects of what you might expect. If we do X, then Y will change, resulting in improved blank. That was one of the versions of the statement. You could also use the other more simple version of the statement. If we do X, then blank will change. Okay. So you really want to sit down and you want to think about, I am going to be asking for funding to support work doing what? Okay. What am I proposing to do? How will that work change the set of circumstances that might lead to improved outcomes for families? Okay. I think that creating a simple diagram can help you. Okay, so you can even draw this out, thinking about it could be a flow chart or a graphical roadmap that uses arrows to indicate relationships or elements of your theory of change. Whatever works for you to really help you synopsize this or create something that is a really clear relationship, expected relationship between the root cause, as we talked about in the theory of change section of the presentation, the proposed solution, and the intended outcome that you hope to change. Okay, the next thing we want to talk about are engaging stakeholders. So, who is it that are your organization stakeholders? We define a stakeholder as any individual that's impacted by the work that you do. Okay. Who are the main stakeholders that are going to be impacted by the program or work you're proposing? You need to answer that question. Once you've identified the answer to that question, engage with your staff and those stakeholders to examine your theory of change. So, if step one was to get this if then statement, to really make a statement about how you think this program is going to change your community, step two is to workshop that. Okay. Talk to some people who actually are going to be affected by this, excuse me, and really ask them, what do you think about this? Does this make sense to you? Does this resonate with your lived experience? Okay. This is the importance of engaging stakeholders from the very, very beginning. So you want to be open to revising it based on what you learn from your stakeholders. Okay. So think about that first step, creating that theory of change as your first draft, and then engaging stakeholders to help you with any revisions you might need to make. The next thing I would say is really embark on designing that program's logic model. Okay, so this is step three. You really want to start by listing out your program's inputs or resources. All right. You want to really use this program logic model as a roadmap to guide your work. Ask yourself, what resources do you need? Okay, not just money, Money is important, but think about time. Think about personnel. Think about physical space. Think about political or social environments. Okay. All of these are key pieces to understanding what resources you need to be able to do the work. Going into the second bucket activities, some key questions. What are you going to do in your program? What specific activities are you proposing? Okay. Then you're going to want to think about your outputs. What services or products will be delivered and to how many people as a function of these activities? Okay, what will you deliver or produce and to whom? Typically, nonprofits, again, are really good at this part. You already know, you can kind of quantify here's how many people we expect to show up, or here's how many people we expect to serve or screen. Okay, but you really need to quantify that and think about what services or products will be delivered and how to how many people. Then we're going to move into typically the more challenging aspect, which is measuring outcomes, the short and intermediate term changes or benefits that you expect the program or work that you propose to do. Okay. You want to think about how the world's going to be different as a function of your work. And most importantly, you need to think about how you're going to measure that change. Okay. All right. Once you get that if then statement and you think about how you think about how this program is going to change your community. And then you workshop it with your stakeholders and you say, does this seem right? Does this look good? And then you work through your logic model. Okay. You need to define your evaluation methods and resources. So you need to think about, and this gets to the point I just made in the end of the previous slide. How are you going to track and measure your outputs and outcomes in your program? What resources do you need? This is where a lot of nonprofits, I think, fall short. They don't really think about what resources they need for evaluation. Think about what resources you need to track and do this. Personnel time, funding, expertise. Can you do it internally? Do you need to figure out another partnership or some other personnel support to help you do it? What data or information do you need and how will you get that information? This is the part that becomes really fun for me, but that's where you get to really think about what information do you need to track as you're delivering this program, okay? So some examples. If what I'm proposing to do is deliver a training, and I think that that training is actually going to change people's knowledge and attitudes and that will lead to a change in behavior, one way that I can measure some really quick short-term outcome changes is a pre and post survey. So I ask some questions in a quick survey before the event. I ask some questions after the training and I see if there was a knowledge change. That helps me capture immediately. Oh yeah, people changed the way they thought about a topic, or people now say that they know more about this topic. That's a knowledge change that you can demonstrate pretty quickly. Okay. If you want to focus on some longer term outcomes or intermediate term outcomes, you might follow up with some people who received a service or training or participated way after the fact, right? Maybe a year from now, I'm going to follow up with someone and say, hey, you attended this training. Did it affect your work or did it change the way that you do what you're doing? Did it improve your life in any kind of specific way? Those are different ways you can grab some quantitative data. Surveys aren't the only way, okay? You can also do qualitative data, so you could do interviews or focus groups with people who are affected or participate in your program. And that's particularly effective if what you're proposing to do has a lot more depth than breadth, right? So if you're proposing an intervention that's going to serve a lot of people, then you might want to think about quantitative data, surveying them. If you're proposing something that's only going to serve a few people, okay, or a smaller group of people, you're going to want to think about qualitative data collection. That's more of interviews or focus group. I think that you want to be clear what you want to and what you want to measure, and then you want to be realistic in what you have the resources and the expertise to be able to do and how that work will be completed. Okay, so just to move into the last part of the presentation, I think that if you've hung with me until now, what you should take away from this is that you can actually begin applying these ideas to your organization's work right now and for in future applications for funding, okay? So as the community foundation in particular engages in grant making, there's going to be lots of opportunities for you to integrate program evaluation into your applications and view this rather than viewing this as a hurdle for this one specific application, view this as an opportunity to really improve your nonprofit's capacity in evaluation and in using evaluation oriented language so that you can build that into other funding proposals as well. Okay. Throughout the life of the funded project, if you're to receive funding from the Athens Area Community Foundation for some grant-related activities, you're also going to be able to share that data and information back with the foundation to show the impact your funded work is having. And that's also an incredible asset as well. Okay. Rather than just checking a box on evaluation, think about it as a really intentional, important opportunity for you to share and do some storytelling around the impact of your incredibly important work. You are doing this work, this mission oriented work, you're changing your communities. And now with this new toolkit, you can measure that impact, start to think about how to measure the impact, and integrate that storytelling and that narrative back out to your donors, your stakeholders, your staff, your volunteers, anyone who is in the orbit of the work that you in your community and what your nonprofit does. So, in conclusion, what I hope that you've taken away from listening to this is that integrating program evaluation components into your operations, into your grant related work in particular, is really important. And the reason it's important is it can enhance the effectiveness of your work and certainly can enhance the sustainability of your work, especially when it comes to demonstrating impact to potential funders. I think that before we go, let's just go back to a couple key takeaways. I would say first, you want to start with your theory of change. Okay. Begin by articulating how your organization really intends to create meaningful change in Northeast Georgia. You want to use if then statements to do that, to clarify a causal pathway between your activities, okay, and the desired outcomes. And then I would also say that you want to make sure you engage your team and community stakeholders in the process of developing and solidifying that theory of change. Once you have your theory of change ready, you can create a visual logic model. That's your roadmap that succinctly represents your program's activities, outputs, and outcomes. This model should highlight the connections among various components, such as resources and expected impacts. And I recommend that you keep it simple in the beginning, but informative, okay, ensuring that it can be easily understood by potential funders and community partners. Just to hit this home, point three, you want to engage stakeholders as you go in the whole process. And then moving into point four here, preparing for evaluation in your proposals. This is an integral part. You want to approach evaluation again, not just as a box to be checked, but as an extremely critical component to your program design. Okay. You can always go back to those four considerations we talked about: utility, feasibility, propriety, and accuracy in your framework. And you really want to make sure to think about on the front end, what does your organization need to effectively do this work? Okay. What do you need? I think that will really set you up for far more success, not just in pursuing funding, but in terms of actually doing the work. And then finally, I would just say embrace a continuous process. So you have to recognize that program evaluation is not a one-time thing. It's an ongoing process and it's cyclical, as I showed you in the CDC's framework. You want to use the insights gathered from your evaluation to really adapt and improve your programs. And that can ensure that your programs remain responsive and relevant to the changing needs of your community. I want to share right now a couple of additional resources that I think are really helpful. There's a lot of resources available to you online around program evaluation. Some of these include a data assessment, self-assessment tool that you can fill out. And there are also templates of logic models that you can access at the Community Foundation website. So in addition to this webinar, the Community Foundation has made some resources available to you. And I highly recommend taking a look at those and really helping use those to guide your application for funding. Additional reading on program evaluation are available online. I particularly recommend, again, looking at the CDC's evaluation framework and the Data Innovation Project at the University of Southern Maine are two incredible resources that you can use to really bolster your understanding of these concepts. I think by really understanding and applying these concepts strategically, your nonprofit can really build confidence and capacity to present its programs to grant makers like the Athens Area Community Foundation. And you're demonstrating in this case a clear understanding how what you're proposing to do is going to lead to meaningful outcomes and meaningful impact in your community. This is not only, again, going to increase your chances of securing funding, but will also increase your organization's capacity to create lasting impact and change. I want to thank you for your commitment to strengthening your community through effective programming. Thank you for your time today, and I encourage you to leverage these frameworks to articulate your visions and goals as you apply for grant funding through the Athens Area Community Foundation and beyond. Again, we're all here because we love Northeast Georgia, so together let's make a difference. Thank you very much.